PEPFAR gives impact. My name is Dr. Isaac Sikutsu, and this is my story. PEPFAR came to Kenya around 2003, and I qualified as a pediatrician in 2004. So when I came in actually as a pediatrician, PEPFAR had just come to Kericho and the South Rift region. We were excited that we have life-saving antiretroviral drugs, but then the challenge was the training. Most of us didn't know the drugs, most of us didn't know the side effects, and PEPFAR organized a very big training. Then after around 1 year, there was the challenge that most children are not being put on antiretroviral drugs because the regimens were more complicated, and PEPFAR organized a training for pediatric ART. We first went through the training of trainers for about 2 weeks, then now came back and trained very many healthcare workers. We've had a lot of trainings. We've been taught as trainers of trainers, then cascaded through PEPFAR support this training to the very smallest facilities. The issue of prevention of mother-to-child transmission came in because it was like a tap that was not being stopped. So you are putting children on ARVs, but others are being born HIV infected. And again, prevention of mother-to-child transmission training was started. As we speak now, we've almost achieved the 95, but there's still ground because quite a number of patients still don't know their HIV status. And through PEPFAR, we are actually doing what we call targeted testing in the communities, through the community outreaches, so that as many people as possible know their HIV status and are put on treatment. Through the investment of PEPFAR in human resource like myself, we've now had a very big multiplier effect. And I started off as a Ministry of Health employee, then crossed over to the PEPFAR program, HF-MRI. And if I look at the program currently, I think PEPFAR, we are now only providing technical support, but most of the work, because of this multiplier effect, actually is now done by the Ministry of Health and the faith-based organization by Kenyans. There is the commander of the US Army Medical Research Directorate in Kenya, Colonel Lesi, who actually encouraged me by saying, don't just look at the numbers, look at the impact. And I have a number of who are adolescents, but they are now young adults, who had many issues, who are not taking their medicines, who got a lot of infections. Through PEPFAR, there was a lot of things that were going in. There were a lot of counselors talking to them. And we've seen them now, 20 years down the line. They are very responsible adults, they are musicians, they work in banks, and now encouraging other adolescents and helping them go through the adolescent and young adult process. And I'm very proud of this, and even if I leave PEPFAR, I think I'll still continue talking about this wherever I will be.